Today's talk is going to be two different sections. One, there's been a lot of hype about certain research recently, and I wanted to talk about that. And then secondly, I'd like to talk about some research studies I think really have some good and interesting practical implications for lupus patients that they could consider putting into effect right away. So on July the 12th, this news article came out and was blasted all over the internet. It was by USA Today, but also NBC, ABC, tons of news organizations did it. The headline was this: "The cause of lupus, a possible cure identified, researchers say in a new study." And this just got blasted all over social media about this new important discovery about the cause of lupus, and a cure could come out of this. And so I wanted to put it into perspective and talk about the study itself. First, this was a very important study. It came out of Harvard by some very good scientists, Dr. Deepak Rao, Dr. Calvin Law, and their associates. And the title of the article was, and this is very complicated, but I'll just say it: "Interferon subverts an AHR June axis to promote CXCL13 positive T cells in lupus." And basically what this study did is that they identified a particular receptor, which you can consider a bad B cell blocker, and that adding a molecule to patients who have lupus and this receptor, that they could actually reduce bad B cells from attracting and stimulating bad B cells and potentially help out lupus. If you want an in-depth description of this research, by the way, on July the 17th, just go to Facebook Live, and there's a very nice presentation by Dr. Carolyn Jeffries, who's the Lupus LA Medical Advisory Co-Chair, and she goes into quite a bit of detail about the research study, but I'm going to simplify it and make it a little bit easier to understand. Now, before I talk about the study, it's important as a lupus patient to understand about some certain things about lupus. And if you do that, you can kind of help yourself weed through what's important and what may not be important on the things that you might see in the news. So first of all, every single lupus patient is different. If I lined up 100 of my lupus patients, I have a couple of hundred that I follow, every single one of them would be different. Lupus experts think that lupus is not just one disease. It's probably a whole bunch of different autoimmune diseases that we're just not able to tell the difference between. You know, how could someone with a butterfly rash and arthritis had the same disease, for example, as someone who has recurrent strokes and heart attacks from antiphospholipid antibodies and who has inflammation of the kidneys? So keep that in mind. Also, there's multiple parts of the immune system that are abnormal, and it's not the same in every lupus patient. Just for example, one hallmark of lupus is that all lupus patients make bad autoantibodies that attack their own body. For example, 95 to 99% of our patients have anti-nuclear antibody that thinks that the nucleus contents of their cells don't belong there, think they're foreign invaders, and that's one way that they attack the tissues of the body. What makes these antibodies is a type of white blood cell called B cells. So B cells make these antibodies that can attack the body. So you might think, so here's a cause of lupus. B cells are overactive. They make these antibodies that attack the body. So what if we can make medicines that get rid of bad B cells? Could that possibly help lupus patients? And we do have those medicines. There's rituximab, which is Rituxan, depletes B cells. There's Benlysta, also called belimumab. It calms down the B cells. But even though B cells are a hallmark of lupus and make these bad autoantibodies in everybody, Benlysta and Rituxan do not work in many patients with lupus. So finding one important cause of lupus doesn't seem to be the answer, and it's not a cure for everyone who has lupus. We already know that from our experience. So if a non-medical story touts that there's a cure for lupus, be skeptical. So just kind of keep that in mind as we go into this research study. And by the way, there's only one treatment that even comes close so far, and that's CAR T cell therapy. Phenomenally, this is one treatment that so far seems to have worked in everyone who has been treated with it. If you want to learn more about CAR T cell therapy, just go to YouTube and search for Lupus LA. CAR-T, CAR-T, and you can learn more about that interesting type of therapy. So another important background for this research study is that in systemic lupus, when we look at our patients with moderate to severe lupus, 75 to 80% of them have a high level of something called interferon. Interferon is a cytokine. Cytokines are ways that white blood cells talk to each other. And when white blood cells release this cytokine called interferon, it tells other white blood cells to become overactive, and it increases disease activity in lupus patients. Now, one way that we've known that this happens is that when interferon levels are high and they activate a white blood cell to become more active, it actually tells the DNA in that white blood cell to make cytokines that cause inflammation. That's one way that we know that it works. But the question is, could there be other ways that high interferon levels cause increased disease activity in lupus? And the answer is yes. And that's what this particular research study looked at. They looked at, we know that high interferon levels, they block a particular type of receptor called the aryl hydrocarbon receptor. Now, this particular white blood cell receptor, when it's important that it be active because this particular receptor on the cell surface of white blood cells helps to calm down the immune system and keep it in check and not be overactive. It's important that this receptor be active because it helps to calm down the T cells, and it keeps those T cells from activating the B cells, which make all those bad antibodies that I just talked about. So high interferon levels, it blocks this particular receptor, which is bad. Then the T cells become overactive, especially two types, one called follicular T cells, one called peripheral helper T cells. And then interestingly, those T cells, they produce a certain type of chemical that you can consider a B cell attractant that attracts B cells that are overactive and causes them to make those bad autoantibodies like anti-double-stranded DNA. So the scientists, they asked this question: what if we could produce a substance that could prevent interferon from binding to that receptor, and then this could result in less bad B cells from being active? And that's exactly what they did. So the study, it took place in 19 patients. That's your first clue that that this study cannot be the end all for lupus, because 19 patients is not very many patients. And then they added a molecule that could activate this receptor that could calm down the T cells and calm down the B cells, make less autoantibodies that could attack the body of a person. And they showed that this absolutely did work, that it did help to calm down the immune system. So the final result of the study was, could this molecule be used to treat lupus? It certainly has an important, it plays a very important role in lupus, and could it be possibly a treatment? And Dr. Rao, who's one of the main researchers in the study, he was quoted in one of these news stories as saying, "I think this is going to apply to essentially all patients with lupus." I think that Dr. Rao just kind of accidentally said those words. You know, when any of us talk in public, like politicians and stuff, it's very easy to say something that you kind of look back at and wish you wouldn't have said, because I don't think that Dr. Rao truly thinks that this is going to apply in all lupus patients, because as I said, every lupus patient we already know is different. And so another problem with this research study, by the way, and why it may possibly not be a cure for lupus, is the following. These aryl hydrocarbon receptors, they're not just found on white blood cells. They're found in many other tissues of the body. And so if you go ahead and add this molecule that makes them active, could you possibly cause other problems in the body? And this is how we get side effects from medications, for example. I'll just give you an example. Over-the-counter Advil and Aleve. Both of those medicines, they inhibit something in the body called prostaglandins. Prostaglandins, they cause inflammation and pain. So you take an Advil when you get a headache or joint pains, and it can help because it calms down inflammation and pain. But prostaglandin is important for many other parts of the body. For example, we need prostaglandins to make mucus lining the stomach. And so when you give Advil or Aleve and it inhibits that production of mucus around the stomach, voila, you can potentially get an ulcer in the stomach as a possible side effect to it. So the same with this, by activating these receptors in other parts of the body, could we possibly cause side effects? And that's something that has to be looked at. So some other problems about thinking that this is a cause and a cure. 80% of patients with lupus have high interferon levels, meaning 20% of patients don't have high interferon levels. So could this mechanism or this therapy be helpful in those 20% of patients? There's a very good likelihood that it may not help. And there's already a medicine out there that interferes with interferon and also plays a role with this receptor, and that's a medicine called anifrolumab or Safnello. That's how it works. It calms down interferon and keeps it from activating white blood cells in the body, but Safnello does not work in everybody, so we still can't say that this is probably a cure for cancer. Also, when you look at potential hyped up stories like this, also look at what other researchers might say. For example, one article by NBC, I think, it interviewed Dr. Jill Byan, who's a great lupus expert in New York City. She said until they study 100 patients prospectively, how are we going to know? In other words, they need to take this molecule that might be a cure, quote unquote, cure for lupus, give it to 50 patients with bad lupus, and then give the other 50 a placebo, then follow them over time and then see how it works. That's how we truly find out whether something works in lupus or not, not just from 19 patients. And also, she also said, even if such a treatment became available, it's unlikely to work in everyone. One drug does not fit all in lupus. And so far, that's been the case, except for possibly CAR T-cell therapy. And so the bottom line is, how do you approach a lupus article that sounds too good to be true? First off, that's what you want to ask yourself. If it sounds too good to be true, it's probably too good to be true. Unless there's other experts, lupus experts, like Dr. Jill Byan, Dr. Dan Wallace at Lupus LA, who chime in and say that, yes, this looks like a cure, then you can probably believe it. And don't believe in hype unless you see those experts chime in like that. So how did this grow out of proportions in the first place? Because it was all over social media. It probably has to do with that they had a lot of money in the public relations department. This came out of Harvard, which Brigham and Williams Women's Hospital. Also, it was a part of a program called the Accelerating Medicines Program, which is backed up by 10 pharmaceutical companies and the NIH. So they had that machinery going that could give it a good PR relationship. And that's probably how this happened in the first place. And by the way, this is just one study of many. There's a lot of great research out there being done for lupus. And when this came out, I asked myself, how many other studies like this are out there that are not being hyped up? And there were dozens that I could find. For example, there was one in arthritis and rheumatism in our latest edition by Dr. Li of China. He found that a phosphatidic acid led to interleukin 17A producing cells, making lupus more active. Hey, if we could inhibit that, could we possibly cure lupus? But nobody hyped that one up. Dr. Sherith Gowda in the journal Lupus, she discovered extracellular mitochondrial markers that correlated with lupus nephritis proteinuria. Hey, could we possibly measure that in lupus patients and not have to always do a biopsy on their kidneys? But that was not hyped up either. And I could go on and on with these kind of research studies. Now, I would like to say, though, This research was incredibly important. A ton of work went behind it. It took many years to get the results that we had. So I don't want to belittle the results. And certainly this could play an important role in how therapies could possibly come out in the future. But we just don't want to say that it's the cause of lupus. We don't want to say that it's a cure for lupus. So that's the first part I wanted to talk about, is hyped up research articles in lupus. Now I'd like to talk about one that Lupus ALA was advertising about this particular event, about omega-3 fatty acids. Recently, there's been two very interesting studies that have come out about the possibility of omega-3 fatty acids in lupus. And this is a good example how thoughts change over time and how research can change our thinking about things over time. In my Lupus Secrets, which is a list of do's and don'ts that lupus patients can look at, I do recommend in there that patients eat an anti-inflammatory diet and consider having omega-3 fatty acids and increased vitamin D, because both of those can potentially help lupus. But I specifically stated not to take an omega-3 fatty acid supplement, because so far the supplements had not really been shown to be useful in lupus. And some experts, like Dr. Michelle Petrie at Johns Hopkins, she preaches to her patients not to take them because they could potentially be harmful, and she just didn't really know. Well, here's two research articles that suggest that maybe these supplements might help out. So first off, before I dive into the first research study, I'd like to just briefly say how a couple of things can possibly help lupus, because this particular research study looked at taking vitamin D and omega-3 fatty acids. So the vast majority of my lupus patients are prescribed vitamin D to actually help their lupus disease activity. If your doctor has asked you to take vitamin D, by the way, please take it. It's one of the most common medicines that patients don't take regularly, but it's so important to take to help your lupus. And why is that? Well, all white blood cells have inside of them a receptor or attachments for vitamin D. And studies show in animal models that if you decrease vitamin D levels in animals, that it causes abnormalities of those white blood cells because they don't have enough vitamin D, and their immune systems become abnormal. And it looks very similar to the immune systems of lupus patients. And then there's been several very nice studies in humans with lupus that showed when you give patients with lupus vitamin D and get their levels up to around 40, it helps their disease activity. So it does seem to be very important. Number two, omega-3 fatty acids. We know that they reduce inflammation and they may decrease the risk of heart attacks and strokes as well. So here's the first study. Dr. Karen Kostenbader, fantastic lupus expert at Harvard, she did this really important study called the VITAL study, VITAL. This is a huge study with over 21,000 patients who they're following over time, where some of them take vitamin D, some of them take omega-3 fatty acids, and some of them take placebo. And they're asking the question, do these supplements decrease the risk of cancer, cardiovascular disease, and autoimmune diseases? And she was looking at the autoimmune disease side of it. So there was over 21,000 adults. They followed them for 2 years, and she asked the question, does vitamin D and omega-3 fatty acid reduce the onset of autoimmune disease in people? People who were taking vitamin D, they were taking over-the-counter 2,000 international units of vitamin D3. And then those who were taking omega-3 fatty acids were taking high quality supplements that had 1 gram per day. And specifically, and this is important because it's important when you take an omega-3 fatty acid that has the right types. And these particular supplements had 460 EPA, which stands for eicosapentaenoic acid, plus 380 milligrams of DHA, which stands for docosahexaenoic acid. And so that's important that they have those particular 2 types of important omega-3 fatty acids. So over 2 years, 514 of those previously healthy people developed an autoimmune disease. Those who took vitamin D, 2,000 international units per day, had a 15% reduction in onset of autoimmune disease compared to those who were taking a placebo or fake pill, especially psoriasis. There was a 40% reduction in the onset of psoriasis. Psoriasis is an inflammatory autoimmune disease that causes scaly rashes on the skin, but also many of them develop an inflammatory arthritis that can be as devastating as rheumatoid arthritis. Now, so they were able to show this especially for psoriasis because psoriasis is a lot more common than lupus. There were not nearly as many lupus patients or people who develop lupus, so it was much harder to say lupus as a particular subgroup, but nonetheless, there was a 15% reduction overall of autoimmune diseases. Now, how about those who were taking omega-3 fatty acids? There was a 13% reduction in autoimmune diseases. But what was very interesting is that when they looked at those people who have a family history of autoimmune disease, because we know that lupus is a genetic, you're born with the genes that cause the disease in the first place. When they looked at those with a family history of autoimmune disease, there was a 30% reduction in the onset of an autoimmune disease. More and more lupus experts, to include myself, recommend that people who have diseases like lupus, that you recommend to your family members that they avoid triggers of lupus and that they do things that can help reduce the onset of autoimmune diseases like lupus. That includes things like not sun tanning and also not smoking cigarettes. There was a study that showed that getting less than 7 hours of sleep at night increases the risk of onset of lupus and family members of lupus patients. But now we can add on top of that taking vitamin D and omega-3 fatty acid supplements, just something that your family members may want to consider doing to help reduce their risk. So now study number 2, and this does involve Dr. Daniel Wallace, who's wonderful in Los Angeles and instrumental with Lupus LA, but also this was a multi-center study. Dr. Jane Salmon in New York City, Dr. Peter Lipsky, who's a lupus expert and now runs a company called Ample Bio. But they asked the question, can krill oil help benefit lupus patients? Krill oil is an important source of omega-3 fatty acids. And why did they choose krill oil? Some experts think that it might be a better source and more effective source of omega-3 fatty acids. It's just theoretical, by the way, but the reason is that the omega-3 fatty acids are incorporated into easily digestible phospholipids. So krill oil is made out of a type of omega-3 fatty acid that's easier to absorb. And just for example, flaxseed oil and chia seed oil, very important sources of omega-3 fatty acids, but they're more difficult to digest and they're more difficult to increase the levels of omega-3 fatty acids in people who take them. But krill oil works much better. So they had 30 patients in total, and 30 patients took 4 grams per day of krill oil. And they compared them to 34 lupus patients who took a placebo or fake drug. And then they followed them for 6 months. And they asked the question, does it increase the omega-3 fatty acid levels? And does it decrease lupus disease activity? So at the 4-week mark, what they showed is that it increased the omega-3 fatty acid levels to significantly in almost every patient. And this was incredibly important because 38% of the patients with lupus who started the study had started off with low omega-3 fatty acid levels, and all of them ended up having significant improvements in their drug levels. Why did they start off with a low level, by the way? It's probably because of the standard American diet, which is horrible. It's low in omega-3 fatty acids. These are the diets where we eat too much red meat, too much processed foods, too much fast food, etc. It's bad for you. And another study, by the way, by Dr. Karen Kostenbader, who I mentioned earlier, did recently show that a diet high in processed foods increases the risk of autoimmune diseases. So eating a standard American diet is bad and results in low omega-3 fatty acids. And by the way, standard American diet, the initials are SAD, S-A-D. It's a SAD diet. Don't eat it. Eat a healthier diet like the Mediterranean diet or other anti-inflammatory diet. But so the study did show that taking 4 grams of krill oil per day did increase omega-3 fatty acid drug levels. One reason why this is important, by the way, is that multiple studies have now shown that when people have a high level of omega-3 fatty acids in their blood, their risk of heart attacks and strokes is significantly lower. So could this krill oil possibly decrease heart attacks and strokes in lupus patients? It's a possibility. And remember, heart attacks and strokes, they're the #1 cause of death in lupus patients, and they happen 10 to 20 years earlier than they should. So any way we can prevent that from happening is important. So the second part of this research study is, can it help lupus disease activity? Those patients who started off with high disease activity from their lupus, at the 4-week mark, the 8-week mark, and the 16-week mark, they had significantly less disease activity compared to those taking a placebo. So the question is, could this krill oil possibly help lupus disease activity? And it's possible. However, there's a caveat. At the 24-week mark, there was not a significant difference between the group taking the krill oil and the group taking placebo. Their disease activity was better, by the way, but it just wasn't a significant difference. And I'll talk about that in just a few minutes. But how about side effects? You know, krill oil, it can have potential side effects, which I'll talk about at the end. Omega-3 fatty acids can too, most commonly like gastrointestinal side effects like belching and burping and diarrhea. But guess what? At the end of the study, there were actually more side effects in the people who took a placebo than in those who took krill oil. Now, does that mean that placebos cause more side effects? No, it just has to do with how side effects are looked at in research studies, and this is always so important to do. When you hear about potential side effects from drugs, don't just take it in black and white that that's going to be a side effect. Actually look at the numbers themselves. Us doctors, we usually don't bat an eye in taking a medicine because we know the actual numbers, and many patients are afraid to take almost every medicine because they're afraid of the numbers. But the way that they look at side effects in research studies is that every time the person comes in who's taking the placebo or the research medicine, they give them a ton of questions to answer, like, have you had a headache in the past week? Have you had any stomach upset in the past week? Have you had any joint achiness in the past week? Well, guess what? I'm not taking any of those medicines, and I could have any of those in the past week, but was it a side effect of something? Probably not. And then they compare the numbers to each other, and then if there's a whole lot more in the drug group, then they can say, yeah, that's probably a side effect of the drug. So, but the problem with this is that even though there were more side effects in the placebo group, you know, this was a small study, only 30 patients in one side, 34 in the other. You really need to have a study that has thousands of patients, like the Benlysta studies, for example. You literally had thousands of patients to answer the question better as far as whether Benlysta works for lupus or not and what the potential side effects are. Now, one reason why this was such a small study, by the way, is that it took place during COVID-19. They designed the study before COVID, then bam, COVID hit, and guess what? There was a high dropout rate. There were 23% less patients than they were hoping for. So when you have a small study, it's much harder to prove things like whether a drug actually works or not. So the big question is, if there was a lot more patients in the study, could we possibly show that this might benefit lupus or not? And that's possible. Also, 2 years is not very long. What if this was a 5-year study? Could we be able to show it better? Also, remember that raise the drug levels of omega-3 fatty acids in the blood work Could it decrease heart attacks and strokes in those patients? We don't know. 2 years is not long enough to find out. But what if this was a 5-year study or a 10-year study? So the bottom line is that these results are incredibly interesting. The krill oil was very safe to take. It did raise the drug levels of omega-3 fatty acids in the patients who took it, which we know can help decrease heart attacks and strokes. And could it possibly help disease activity? Possibly, but we don't know for sure. And the dosage again was 4 grams per day. But let's look at the potential side effects of krill oil and omega-3 fatty acids as a whole. Number one, gastrointestinal side effects are by far the most common: burping, diarrhea, reflux, things like that. So if you do decide to take it, start off at a low dose and go up slowly. Also, we know that high doses of these omega-3 fatty acids can suppress the immune system. So another question is, could they possibly increase infections? Well, so far, no studies looking at omega-3 fatty acids have shown increased infections, so that's a nice thing. There is a group that I like to follow on the internet called Consumer Lab. ConsumerLab.com is a really nice group of scientists that actually study over-the-counter supplements. You know, the problem with over-the-counter supplements is that when you get an over-the-counter supplement, you never know if it's a good quality supplement or not, because the FDA has no regulations over it. For example, if you take a vitamin D supplement, that vitamin D supplement can have anywhere from as low as 25% of what it said to 150% of what it said. And so and by the way, if you take an over-the-counter vitamin D supplement and you're my patient, I don't care, because as long as you take the same brand all the time, then it's no problem. I can just follow the drug levels and figure it out. But if you want to know if a supplement's a good quality supplement or not, go to consumerlab.com. They also show the research studies that show the potential benefits and side effects of supplements like omega-3 fatty acids. But this particular company, it does recommend not taking more than 2 grams a day in most people, just to help decrease the potential for side effects. But that might not apply to autoimmune diseases, by the way. And after these research studies came out, there was a very good article in Arthritis and Rheumatism, and an expert in omega-3 fatty acids made the case that people with autoimmune diseases do need high doses in order to help them out. Another important thing is that these omega-3 fatty acids can potentially thin out the blood, so you do want to stop them before surgery to make sure that you don't get any bleeding problems. However, there was a study that actually gave people high doses of omega-3 fatty acids before surgery, and it had actually no bleeding problems. But until we know for sure, we do recommend stopping them, especially if you're on other blood thinners, such as aspirin, for example. The other question is, how about people who are allergic to fish? I get anaphylaxis if I get exposed at all to any type of crustacean like shrimp or lobster. But you know what? I can take fish oil supplements. I can take glucosamine made out of fish because I take high quality products where they get rid of those bad allergens. They did do a study, by the way, looking at people with bad fish allergies, and they showed no reactions in one study on this. But I don't want to tell you that because I don't want someone who has a fish allergy to take one of these and have a bad reaction. But you know, out of all the fish oil supplements that have been taken, there's only one case report that I know of a bad reaction to these in a fish allergic patient. So the other potential problem with omega-3 fatty acids is atrial fibrillation. There is a study out there where they took a large number of healthy people, and what they showed is that in those who took omega-3 fatty acid, there was a 5.3% prevalence of the onset of atrial fibrillation, and those who were taking a placebo was 4.1%. So not much of a difference, but there was a slightly increased risk in those taking omega-3 fatty acids. My takeaway point from that is if you have pre-existing heart disease, you want to be careful and talk to your cardiologist before you take these. And if you do take a high dose of omega-3 fatty acids, make sure your cardiologist monitors your heart rhythm and make sure that nothing happens. It's a question. We don't really know if it happens or not. Something that can definitely happen And any supplement that can potentially help a disease, by the way, those supplements are not always safe. All of them can have potential side effects to include interacting with other drugs. And that's the case with omega-3s. Omega-3 fatty acids can increase the drug levels of tacrolimus, cyclosporin, and sirolimus, which are all used to treat lupus patients. So you have to be careful and ask your doctor about potential drug interactions. And then we don't recommend taking cod liver oil or other fish liver oils as a source of omega-3s. Only take pure, high quality, actual omega-3 fatty acid supplements, because other types of oils like cod liver oil are high in vitamin A and high in vitamin D, and you might get too much of those if you take them. The bottom line is omega-3 fatty acids may potentially be helpful in lupus patients. They could potentially help decrease the onset of autoimmune diseases, but since there are potential side effects, potential interactions with other medications, especially blood thinners and medicines like tacrolimus, don't do this until you ask your doctor first. I'm not your doctor, and I can't tell you what to say, but I can at least tell you what the research studies show, and things are looking brighter and brighter for lupus patients. And then I'm open to answer any questions, Brianna.
Awesome. We have a few. So the first question was from the beginning of your talk when we were discussing the studies. Someone asked, what was the study name for the higher interleukin activity that could be affecting people, some people with lupus?
Oh, it's actually a lot of studies. Actually, going back to, I believe it was 1979, it was a big NIH study, and they're the first ones who showed that when they looked at their patients with moderate to severe lupus disease activity, 80% of them had high interferon levels. And then there was a bunch of research studies after that to include a large pediatric lupus research study. So, and by the way, just think about that. Interferon was found to be high in lupus patients way back in 1979. But
Wow.
it wasn't until a few years ago, many decades later, that a drug called anifrolumab or saphnelo that inhibited those interferons actually was developed and was shown to work. So it can take a lot of time before a discovery is made in lupus and until a therapy actually becomes available from it. So that's another interesting thing about this. So lots of studies have shown it.
Wow. Yeah, that's such a crazy example, that timeline. So another question that we received was, I heard a lot about issues with fish oil supplements being rancid. Is there a way to make sure that what you're taking is something that is effective?
Yeah, and that's always the big problem with any over-the-counter supplement. Rancid basically means that I'm sorry, that's my dog and probably the Amazon guy. Anyways, any type of oil like fish oil can become rancid or bad if it becomes too warm or if it's kept significantly past the expiration date. Anything that's an oil-based supplement, you really want to keep it in a cool, dark place to keep it from being rancid. And when you buy these things at a store or from Amazon, you have to ask your question, how well was it handled, from the time it was produced to the time it was put into a truck and delivered somewhere? Could the truck have become hot and those supplements become bad? That's always a possibility. So again, you want to find a high quality brand. Probably getting it directly from the producer is probably one of the better ways to make sure you get a high quality product. And again, I go to consumerlab.com to find out what the high quality products are in order to know what to get.
Okay, perfect. Someone else asked, is flax oil less likely to cause stomach upset and side effects like with krill oil?
I'm sorry, ask that question again. Which?
I think this person is asking if flax oil
Oh,
is less likely to cause stomach upset than some of the side effects with the krill oil and the fish oil.
yeah, I've never seen a head-to-head study, so I don't know how to answer that, but I will say that that's one of the most common side effects of taking flaxseed oil and chia seed oil. So we don't really know unless they do a head-to-head study.
Okay, and then it looks like our last question here is about the absorption of omega-3s. Is there anything diet-wise other than avoiding inflammatory foods that patients should know about being able to increase the likelihood of the absorption of omega-3s?
Yeah, I'm really not sure and how to answer that question. I do strongly believe in eating an anti-inflammatory diet because there's so many research studies that out there that show that inflammatory diets like the SAD diet do seem to be associated with increased inflammation and heart attacks and strokes and possibly autoimmune diseases, while Mediterranean diets and other anti-inflammatory diets or having diets that are high in prebiotics like resistant starches seem to be associated with less problems from those particular disorders. But as far as the absorption itself, I'm really not sure how to answer that question because as I just mentioned, we know that flaxseed oil and chia seed oil, it's harder to increase those omega-3 fatty acids in the bloodstream compared to the fish oil. So probably a diet where you're eating foods that include fatty, watery, or fatty fishes like salmon, anchovy, sardines on a regular basis might be better absorbed than a diet that's higher, that's a vegan diet that's higher in flaxseed oil and chia seed oil. However, more and more evidence shows that that a vegetable-based diet or a plant-based diet is better for us. So there's a lot of unanswered questions that out there as far as the role of diet, but I do strongly believe in an anti-inflammatory diet. So I don't know how to answer that question as the bottom line.
I think that was a great answer. I mean, you gave us a lot to think about. Thank you so much for your time today, Dr. Thomas, and for sharing all of your thoughts with us. Is there anything that you would want to say to patients before we sign off?
Just keep it. Thank you for being here. Knowledge truly is power. My lupus patients who learn as much as they can about lupus absolutely do the best in the long run. So keep doing this. Join Lupus LA. It's a wonderful advocacy group, and I hope everybody has a good weekend.
Awesome. Thank you so much.